heart has many doors, actually 4 of them. They can become narrow. Can you talk about that a little bit and how you could sometimes fix them?
Sure. Those doors, as you call them, inside the heart, we refer to those as valves. And the major purpose of the valves inside the heart is to maintain the blood flowing in a forward direction through both sides of the heart. So each of the sides of the heart, the right side of the heart, which pumps blood to the lungs, and the left side of the heart, which pumps blood to the main circulation, have 2 of those doors if the heart is a normal heart. One of those doors on the right side of the heart opens and allows the blood to go into the pumping chamber, and one of those doors guards the exit to the pumping chamber and allows the blood to leave the pumping chamber on the right side. And it's a similar arrangement on the left side. The shape and the size of those valves is a little bit different on the right side of the heart, and they have different names. But the job of them, generally across the board, is just to keep the blood flowing in a forward direction.
If they sometimes will stretch them, but if it doesn't work, then you have to do more definitive surgery. Is that true?
Well, there's really 2 basic problems that can occur with these valves. And depending upon their location, those problems may be more or less important. But either those valves can develop leakage, which means the blood that flows backwards when the heart beats instead of keeping going in a forward direction, or they can develop a blockage. Generally speaking, when these valves develop a blockage, placing a balloon inside one of these valves and opening it can be successful for opening up the valve. That's an individual decision based on the size of the valve. It's an individual decision based on the location. And so we always have to customize that. But in general, that is, in many cases, the first line of opening up one of these valves. If the valve sits in a normal size ring, but the edges of it have grown together or formed in such a way that they're stuck together, then the balloon technique can be very successful in opening up these valves. If, in fact, the ring that the valve sits in is small, no matter how much we balloon the valve, the ring will not be enlarged, and ballooning for those valves will generally not be successful. In addition to that, some of these valves have a blockage not only in the valve, but in the passageway leading into it and in the passageway leading out. And again, in those circumstances, ballooning may not be as successful. In those patients, for many of them, we're able to make a cut, actually, through the area of the valve and enlarge it.
You have to replace valves sometimes in children?
We do. We do the very best that we can to avoid valve replacements in children, and we always prefer to repair the patient's own valve whenever it's possible. The problem with replacing valves in children is that they may wear out over the course of a lifetime, and generally in children we're talking about 50, 60, 70 years. In addition to that, some valves require blood thinners, and blood thinners are necessary medications for some children, but we try very hard to avoid blood thinners in children because they're active, because they tend to fall, because they can injure themselves, and then they may bleed more than a child who's not on a blood thinner. Valves in children have to work harder than valves in adults. The heart beats faster in a child, and so the wear and tear on the valve itself is much more in a child than it would be in an adult, and so they tend to wear out quicker. And finally, the biggest problem that we have is that if a child is small, we may not be able to replace their valve with a valve which is big enough for them when they're an adult, which means that once we've replaced the valve once, as the child grows, it may have to be replaced multiple times in the future. So those are all reasons why we try to avoid valve replacement in children. But it is necessary, and we do it in some circumstances, and there are many children who've had valves replaced and have excellent results.
Thank you very much.